When will we see the peak? Where is the peak? What exactly will be the peak? And when eventually will there be the flattening of the curve? For the first time, and let's begin with some good news, for the first time, the number of active cases are lesser than the number of recoveries. You see that blue line, that is the number of people who have recovered. Now, will this trend continue? Because if it does, it's very, very good news. So that's great news that we are hearing at this moment. In fact, our fatality rate is also in control, the national average. As far as our cases of death are concerned, our cases of recovery are concerned, all of that is improving. 48% and above is the recovery rate in this country. So if you look at the death toll, 7745, 2.8% is the death or the mortality rate as of this moment in this country, which is great if you compare it to 4 weeks ago or 2 weeks ago. But then there are a lot of other factors also which are of huge concern, and that concern is, when is this peak coming? We do not know where that peak is, and in just a short moment we'll show you a global graph to show that India's cases are rising. So we still haven't seen the peak. Let's quickly take a look at that peak. When will we flatten the curve is the question, but let's quickly take a look at the global picture. So if you see the graphic, the line right at the top is United States, dramatic increase, but then slowly it's become flat. The little creepy line that you see, the line towards the end, the last line, you can see that that thin line is India, which is not flattening. United Kingdom is going down. All other countries, you can see slowly it's getting flattened and going down. We've sourced this from our world in data, but India continuously rising. So that is a matter of huge concern. Dr. Sanjay Nagral is with us, and also Pankaj Kumar Pandey is an IAS officer, Commissioner of Health, Family Welfare of the Karnataka government, is also with us. Let me begin with you, Mr. Pandey, first. Your experiences in the Karnataka government. Is this a matter of huge concern? While we celebrate or while we heave a sigh of relief that the number of recoveries have increased, at the same time, there is also this concern. When are we going to flatten this curve?
I know. Good evening to all the viewers. Actually, I think the real battle has begun now. When we have opened the economy, when the unlock 1 has started. And this is the time when the cases are likely to increase. Now, the entire thing is, instead of a peak, we should talk about plateau, that we should not have a sudden peak. We should have a plateau where we are able to contain the number of cases, and the number of cases coming trickle rather than coming in a huge bunch. And that is what all of us are trying to do in Karnataka and all over the country. All the states are trying to do that. The entire focus should be that we should try to avoid a sudden surge of cases, and that will be possible only when we are able to test and trace properly and try to then segregate those people who are the likely COVID cases. And for that, we need to have an elaborate surveillance system in place. The surveillance system should be able to catch hold of the people who have got influenza-like illnesses, ILIs, which are your first sign of COVID, or it should be able to catch the people who are there in our hospitals and who are severe acute respiratory infection patients. And this is where our entire focus should be. We should try to catch the ILIs. We should be able to focus on the SARI cases, get them the proper treatment as per the protocol, and then try to isolate. So this is the entire thing. So that will be able to do if we are able to do a lot of tests and the tracing.
Okay. Dr. K. Srinath Reddy, President of the Public Health Foundation, is also with us. D.S. Rana, Chairman of the Board of Management, Sir Gangaram Hospital, is also with us. And Dr. Kuganatham, he is the member of the Medical Expert Committee of Tamil Nadu. He is also with us. Thank you so much, all of you all. Dr. Sanjay Nagral, how do we explain this? What should be, according to you, in your assessment, should be the time where we should be able to tell ourselves that the worst is behind us?
So Sanket, first of all, I'm not an epidemiologist. You have other panelists who are probably in a better position to answer this. But you started with examples of other countries, and perhaps we see a certain pattern in which the other countries peaked and then flattened and went down. But we must remember that those countries, the capacities of their system, the social norms, etc., are very different. The densities are very different. So I'm not sure whether we can extrapolate from those countries. What we are seeing in Mumbai right now is, of course, a rising trend. We're also seeing a slow rise in deaths, which is very worrying. And Mumbai is particularly worrying because we are hitting the monsoon. And, in the monsoon in Mumbai, there's a huge load on the healthcare system in terms of other diseases which come up, dengue, for example, and malaria. Finally, Mumbai opened the lockdown. And, I think there was huge confusion in the minds of people between opening the lockdown and the virus going away. So, many people sort of behaving as if the virus has gone away, which it is not. So I think the CM saying that they will be watching the situation is very valid, because we are seeing huge crowds and people that social distancing is not really being followed very well. So it's worrying, and it may mean a surge of cases.
Okay. DS Rana is also with us from the Sir Gangaram Hospital. Mr. Rana, I want to ask you, this point on hospital bed availability. See, now that unlock has happened, I was speaking to the Health Minister of Delhi, and he said we have learnt what we had to from the lockdowns. The best way to go forward is prevention, right, and preparation. One of the things with which you can prepare is actually have state-of-the-art facilities, converting open places, creating more beds. Do you think we'll be ready? Do we have any estimate on the basis of which we need to prepare?
Sanket, I am not expert in telling this as far as epidemiology is concerned. I think Dr. Reddy is there, he will be able to tell us better. But I can only say the trend which I see over the last 2 months. In the 2 months back, anybody will get positive report. They were very much afraid, and because of panic, they were getting admitted in the hospital. And our recovery rate was very high, and the mortality rate was very low. But now what I seeing that most of the time we are refusing admission for those so-called less symptomatic patients. And relatively what I'm seeing over last 1 week, that people do agree for home quarantine, for staying home also, for home care as well. But the people those who are coming to the hospital, they require more of ICU beds rather than ordinary beds. And the mortality rate is going up now. So as far as that part is concerned, I don't know how many we require ICU beds. And ICU beds cannot be created in hospitals or the hotels or schools or anywhere. For ICU beds, you require ventilators, you require monitors and all paraphernalia. So I think that most of the ICU beds will be available in tertiary care hospitals. But so I don't know what will happen to non-COVID patients then. I think there is a big challenge.
There's a big challenge, absolutely. And from what you say,
very big challenge. And the big challenge is not only from the number of beds, so of course, they were always less in any case to deal with even non-communicable diseases or ordinary diseases. Now this is an extraordinary, unprecedented situation now. In this case, the biggest challenge is the manpower. From where will we get doctors? From where will we get nurses and paramedics to provide care to the patients?
Okay. Dr. Reddy?
You require people from critical care medicine.
Correct.
And especially anesthesia and all those things. So that population is limited,
So, Dr. Reddy, you heard what Mr. Rana had to say, what Dr. Nagral had to say, the experiences of the Karnataka government. I want to now ask you, Dr. Reddy, all of this will depend on when we are able to flatten that curve. I don't think we have an estimate, or the government has an estimate as to when will that happen.
I think we are asking the wrong question.
Okay.
When you're talking about flattening the curve, you're talking about the number of cases being reported each day. That will entirely depend upon the number of tests being done.
Correct.
If you want to flatten the curve in the next couple of days, just reduce the number of tests. That's not the way to go. So despite the number of tests increasing, how are we actually going to determine whether we are turning the corner? The only clear statistic that we can get is not even recovery, because most people will recover anyway. That depends upon when you are actually examining and whether you are taking a cumulative number. If you are taking the cumulative number right from the beginning, obviously you're going to see more cases recovering. The real clear statistic that you're going to be really looking at is the number of deaths. Even when you look at Italy, Spain, or even UK announcing that now they're going to start relaxing, that is based upon the number of deaths coming down, COVID-related deaths. Of course, we need a better count of deaths and better methods of doing it. Now, regarding the question of how we are going to deal with the issue of increasing number of cases, certainly we need to create more facilities. But firstly, even as the Delhi Chief Minister today has issued recent guidelines for home care, the claim in that, which I support, is that about 80% of the people are very mildly infected and can mostly recover well at home. So we do need to create facilities for home care. At the same time, when we are looking at facilities for hospital care, fortunately, it has emerged over the last 3 months that ventilators are not really required in very many, in fact, in very few, and they don't make much of a difference. So if all that people require is essentially oxygenation, then many of the currently available hospitals can actually be converted into step-down intensive care units, which need not be as sophisticated as an advanced intensive care unit. So we have to start off looking at a mix of measures where we can look after people at home well, and at the same time create facilities which are both sort of step-down, sort of a less intensive care facilities and advanced intensive care facilities.
No, one of the things that Mr. Rana said is very, very interesting, that you can't create, you see, when a COVID patient comes to a hospital, he needs critical care, Dr. Nagral. This is a patient in need of critical care, and you can't really recreate an ICU system in a hotel or even in a banquet hall, in a stadium.
No, so in Mumbai, that's one of the things that with very good intention, people are trying to talk about creating ICU facilities outside of hospitals.
Okay.
And I don't think that's going to work, because if anyone understands a critical care unit without or with ventilation, it needs a big ecosystem, supportive ecosystem, at least 7 or 8 other departments. So I think what we need to really focus on is hospital capacity. In cities like Mumbai, there are lots of hospitals with capacity where the ICUs need to develop. This thing about taking over grounds, building ICU facilities there, I think is something that needs to be reconsidered. I'm not sure how good the care will be in those kind of facilities.
Okay. Dr. Kuganatham is also with us. I want to come to you, sir. If you could like to tell us a little about your experiences in Tamil Nadu. This is a problem which is not, as we've been doing programs time and again, it's not restricted to just Delhi or Mumbai. It's very interesting to understand how other states are dealing with, for instance, your state. Based on estimates.
I'm an epidemiologist, as well as I handled several epidemics in the past 30 years in Tamil Nadu and Chennai. And here, our public health system in Tamil Nadu is a wonderful system. Everybody knows about it. It's one of the best systems in the country. And we have got peripheral centers, we have got urban primary health centers, everything. But only thing is, as an epidemiologist, what I feel is the entire epidemic was misconstrued in our country, especially in the southern parts of India also, throughout the country also. Because Italy, Spain and America and other places, Spain and all, patients were pouring into the ICU and they were also looking for the ventilators and other things. But here in Chennai and Tamil Nadu, we are not getting lots of critical cases. because of the media and also the medical community making a big alarm about it. Large number of people who are tested to be positive, asymptomatic positives, they are all rushing to the hospitals. The critical care, the patients who are requiring critical care are only about 15 to 20%. This is the scenario that I see in Chennai as well as in Tamil Nadu. We are in a position to control all this spread and the hike of cases in almost all the districts except Chennai and surrounding districts. In Chennai, during this lockdown, there are some labor areas like we have got 3 zones. The zones have got a lot of working class people and the slum areas where the houses are very, very small, the slum transport houses. People were not able to follow these restrictions of lockdown. There was a mixing. These are all the places which are recording more number of positive cases. But all the positive cases, they don't go in for complications or symptoms. So what we are trying to do in Chennai is, in almost all the government hospitals which have got more than about 10,000 beds, we are restricting these asymptomatic people to the quarantine, and they are given quarantine care. And all the critical cases are being taken care of, but it's less in number. As Dr. Reddy or somebody who talked earlier, the usage of ventilators are really coming down. It is not much in use.
Okay.
And actually, the lockdown, the positivity rate of this middle age group and the lower age group, if you see, they are the potential risk for infecting their family members.
No,
or elderly people.
but then, sir, you know, all of this depends on your experiences till now. Dr. Rana, I want to come to you.
Yeah,
see, this depends on the experience till now. The thing with this virus is that at a time when cases are rising, we have gone for an unlock, right? So the true picture of what unlock has entailed will be known, say, a week or 10 days from now. If I were to, and I'm no expert, if I were to understand the cycle of how this invisible enemy works, you get to know its real impact in about a week or 10 days. Dr. Rana, you were raising your hand.
Yeah, I want to tell one thing to Dr. Reddy and others. There is no doubt that only about 15 to 20% require hospitalization when their oxygen saturation start coming down. But let me tell them that normally in intensive care units, critical care people are there. It is about 70 to 75% people, those who require ventilators. The rest of people, they do with the oxygen also. But let me tell my experience at Sarganganam Hospital. I had discussion with my critical care chief today, and the requirement of ventilator to the tune of 90%. Whether it makes difference or not, I know that once people go on ventilator, majority of them die. But let me tell you, some of them do recover, But the requirement of ventilator is very high. If questions say that ventilator do not make any difference, then we do not put anybody on ventilator. But the question is that people, though you are admitted in ICU, they invariably require ventilator to the tune of 90%. So I don't think this is incorrect to say that ventilator are not required. Ventilator required. So 0.5%, even if they are requiring 0.5%, that makes in this country a very good population.
The point is that these medical facilities have to be ready, more so because we do not even know. We do not even know when that peak is going to come, how many more cases are we going to add. These are just estimates as of this moment. I think the whole world is grappling with this, and maybe we just have to be prepared collectively. Thank you so much, all of you all, for joining us on discussion number 1.